Hey, it's Brian from Strong Tower, Neuro Performance Coach, and I'm back with our low back pain series. This is our part 3 today, and we're going to be using a jump stretch resistance band. So if you have a band handy, we'll need that. We're building on part 1 and 2 where we talked about getting a foot position and a knee position, either bent or straight, and a pelvic position tucked, anterior or posterior tuck in the pelvis, to find your position of safety or what feels the best for your back currently. So my imaginary position, or the one that I'm saying helped reduce imaginary low back pain for me, was bringing the feet to neutral, bringing the knees into a bend, and then tucking the pelvis, or tailbone tuck. So also eye position we talked a little bit about, so I did an eyes up position. The eyes influence muscle tone body wide. We have oculomotor reflexes, or eye muscle reflexes, that cause a ripple effect, not just from the neck up, but also the neck down in the body. So when we look at that, we want to find the position that feels the best to you, where there's the least amount of pain, and we're working towards that one pain-free repetition, building those one repetition at a time, one pain-free rep on top of each other, doing one and then another and another, to prove to your brain that movement is safe. And then we're getting a lot of the benefits like increased blood flow, increased joint mapping, where your brain understands how to move your back better and do it without pain. So that's what we've been working towards. Today we have a really good one to build on last week, where we did some of our position specific, our safe position gliding in the spine. We did a little bit of side bending. So these could be assessments today. You could check, hey, how does my side bend feel? Side to side, lateral bend, in that safe position with the feet, either neutral, out, or in. If you didn't catch those positions, just go back, watch video 1 and 2 in the series, and make sure that you catch up and get your position of safety, your best position for doing some other back retraining movements. So we're then in our safe position, and we can also glide right to left. So if you're getting better at these and seeing a reduction in pain overall, probably ready for adding in the next step, and this is rotation. So if we take the band and we're securely anchored on to something there, a lot of people, if we set this up, I've got feet forward, knees bent, pelvic tuck, my position of safety. If we ask you to rotate, a lot of people would rotate the trunk over the pelvis, or they would turn the shoulders and rotate through the lumbar and thoracic, mid-back, and low back. That's great, and it's a great option. Often feels good to a lot of people. The other option that we have in differentiating upper and lower body would be to fix the upper body still and then move the pelvis. So now I'm keeping my torso forward. I want my shoulders, hands, and even maybe navel to stay primarily forward. And then I'm trying to focus on letting the knees turn and the pelvis turn to the side underneath that stability. And so if this feels good, we could get 20 or so reps. And then we'd go back and recheck your spinal mobility. So maybe we go back to our position of safety, and if your range of motion was a certain amount of degrees of lateral bend to the right, certain amount to the left, now if there's more range of motion, or you're having less discomfort, less pain, that rotational movement, we would say as a precursor to our reassessment, was a great exercise for you. So you could also come around and do that on the other side. And this can be an amazing tool in upper lower body differentiation. You could do it with or without a band. It's nice to have the band to create some additional tension, load, and strength work on the midline, but you could do it without a band too. Really useful tool though to differentiate upper and lower body movement. Not always just moving the upper body in rotation, but sometimes moving lower body in rotation. So try this out. Remember to subscribe to the channel, like the video, and let us know what kind of results you saw in the comments.